Hello, everyone. This is group number 5, and this is our project. This is our client, Miss Sasha Marshall, and here is a little TikTok about her life.
Hi, I'm Sasha Marshall. I'm 22 and I go to UCLA as a med student. I was diagnosed at 16 with hearing loss. I struggle every day with hearing and speech understanding, and this is just a glimpse of my life.
I asked you for 5 milligram of morphine, not 15 milligram of morphine. Please, next time pay attention. We're dealing with a human life here.
Oh my gosh, what was that about?
Up. I couldn't completely hear her. I thought I was supposed to give the patient 15 milligrams.
Hey, yo, West Coast Sasha, you're never gonna guess this. Bartender just hooked us up with a free drink. You want one?
What? Another drink?
I know the music's kind of loud, but I'm asking, did you want another drink?
Yeah, sure. I'm starving.
During Sasha's initial interview, here are some additional questions we would ask her as a clinician to better support our patient. For the first question, we would ask that in order to know the foundation of her initial hearing loss and how it may have affected her diagnosis. The second question would be asked because it is important to be aware of additional issues, as it can help us as a clinician to narrow down possible recommendations such as devices, monitoring techniques, and any other training that may need special accommodations to better fit the patient. The third question would be asked to see the patient's comfort level and the extent that they'll go in order to improve their goal of speech understanding. We would ask the fourth question to help us get more background information of what techniques may or may not work for the patient in the past and come up with alternatives. We would ask the fifth question to see why it may not have been so beneficial the initial time when using her hearing aid paired with a tool, and what we can do as a clinician to improve that experience. We would ask the sixth question to see if the patient has any other goals they want to touch base on that may or may not be related to the initial problem. And the last question we would ask Sasha is done to help the clinicians come up with a plan that's best suited for the patient and the clinician in a reasonable time frame. So in other words, not a rush plan, but rather a steady time frame for certain checklist.
Sasha's audiogram results confirm that she has a bilateral sensorineural hearing loss. Specifically, Sasha's hearing loss is mild. In quiet situations, Sasha's hearing will be unaffected. However, if background noise is present, Sasha will have difficulty hearing and understanding, especially quiet and soft conversations. The speech recognition threshold test examines the softest sound level Sasha can hear and repeat words correctly. Sasha's SRT score is 30 and 35 decibels. Sasha's SRT scores validate her audiogram results. It explains why Sasha has had difficulty understanding her friends and listening through a stethoscope. The audiogram on the left is a representation of Sasha's hearing loss. The red area represents the sounds Sasha is unable to hear, which includes talking and whispering. Sasha also demonstrated excellent word recognition in her WRT results. This confirms that Sasha's speech understanding is better once volume is added, which could be assisted to her via a hearing aid. Sasha's tympanometry results are normal and show no middle ear damage, confirming that Sasha has a sensorineural hearing loss.
It is very important to provide a hearing evaluation depending on a variety of factors such as degree of hearing loss, patient preference, other physical and cognitive impairments, device costs, age, and lifestyle. This will determine the type of hearing aid that is suitable and appropriate for Sasha's needs.
Completely in canal hearing aid, or CIC, is the most beneficial choice for Sasha. In order to accommodate her needs in different environments, it is suggested to use a digital CIC with an automatic directional microphone, which will allow her to switch from omnidirectional to directional and vice versa. Sasha will be undergoing auditory training speech reading as well.
But why did we select a CIC? Sasha has a mild hearing loss in both the left and the right ear. She is not an eligible candidate for the cochlear implant or a bone-anchored hearing aid because she has a sensory neural hearing loss and she does not have a severe to profound hearing loss. We also ruled out ETE and the ITE due to its visibility, size, and sound distortion. CIC is worn completely inside, therefore having the ability to place a stethoscope in virtually invisible to satisfy her cosmetic needs. We are not aware of any dexterity or visual acuity issues, therefore there will be no problem with application and removal.
The process of fitting a hearing aid includes audiological evaluation, hearing aid evaluation, fitting or orientation, verification, and validation. Prop microphone technology and speech mapping will ensure that Sasha can optimally hear those frequencies, comprising the speech spectrum using the CIC hearing aid. These measures are collected for hearing aid verification. Sasha can attend hearing aid orientation to learn more details on application and removal. This slide here shows a visual representation of a CIC and instruction of proper use.
The CIC is custom fit to your ear. It is easy to remove with a small transparent wire, and it is the second custom hearing aid style, which is less visible than the larger custom styles. It has increased high frequency gain, reduced occlusion effect, and improved localization of sounds. It may be costly, but there is greater patient satisfaction. It can be used easily with telephones and stethoscopes. It can be used outdoors, in restaurants, and loud groups.
When monitoring Sasha's progress, we first want to administer a receptive language assessment. We want to do this before receiving the CIC, immediately after, and 3 months after the initial date she has been assessed in order to observe progress. We want to do this so that we can measure how she is understanding spoken language, since that is an issue that Sasha is experiencing and it is affecting her social and work situation. We will monitor her progress through the initial collected results of measures and subjective impressions through questionnaires and/or the use of daily logs and self-report skills. We want these scales to address benefit, satisfaction, use time, residual activity limitations, residual participation restrictions, impact on others, and the quality of life. To further monitor her progress, we will be scheduling frequent visits throughout the first year of using the hearing device to go over the daily logs and self-reports and discuss any questions or concerns that she may be experiencing. During her annual visits, we also will be monitoring her hearing, making any kind of adjustments if necessary, evaluating the effectiveness and performance of the device, and making sure that everything is functioning properly for her. We will be maintaining close contact and frequent communication with her via phone calls and emails, and just providing any kind of written materials in order to best support her.
What's going on, everyone? My name is Ryan, and lastly, we just wanted to talk about additional interventions and supports that we can do to help with Sasha. The big thing is we need to help her cope with change. As we all know, losing your hearing can change a lot of your daily habits and affect you in a lot of different ways. So even though we are audiologists, we are still stepping in as an unconventional role, meaning that we're the first person that usually sees them. So we need to be aware of the resources that they can use to further their support. So for example, if they have psychological symptoms because of the hearing loss, we could refer them to different psychotherapists. Other things we can do is provide her with areas that we struggle with, like what is she going to struggle with the hearing loss, provide her some communication strategies, and explain to family and friends that their communication behaviors are going to need to be changed in order to communicate better with Sasha. Lastly, there's a few different auditory strategies we can use to help her communicate in a better manner, but the overall strategy here is with a combination of the auditory strategies and coping that Sasha would benefit greatly from the treatment that we have provided here. She's able to, she's in great position to keep her communication ability at high levels. We want to use the biopsychosocial model because we want to look at her as a holistic person and understand that there are other things that come with hearing loss. This gives us a more holistic approach when creating a treatment plan.
And that is our presentation. Thank you.